It's Tehatchapod time. Key Budge, Greg Garrett today. Greg, we've got special guests. We've got a room full of people today.
I was just going to say a room full because we do have room full and we need more mics, Key.
Okay, I'll make a note. You want me to take that to council?
Well, we'll talk about it.
Okay, we'll talk
How's
offline.
that?
Okay,
Yeah.
we'll talk about it offline. But today, a special guest joining us all the way. You came from Bakersfield. Bryn Kerrigan, Director of Public Health for the County of Kern. You are our Public Health Director. Welcome.
Thank you. I'm so happy to be here. Thank you for having me.
And then Elizabeth King, a member of your team from Environmental Health. Elizabeth, welcome.
Thank you for having me.
And then this is funny, as we talked about the conversation and where we're going to go today. We invited Chief Richard Standridge from our Tehachapi Police Department because there is a connection here and you guys work very closely together.
There is, and thank you for having me back again, and I look forward to seeing where this conversation goes.
Yeah, I think we're going to have a very informative conversation today. And I also want to recognize Michelle Corson in the back. Michelle is a guest from the past. So Michelle is waving to us from a distance, and she's joining us and in support.
That's why we need another mic. So she's too timid to come up to the table.
She's a veteran.
She's a veteran.
Michelle's
she was
a veteran
on
of
the
show.
podcast before.
She's been there, done that. So we give her that credit. Yeah. And then Maya is here. Maya is also taking some photos and shooting some videos. So that way people get a visual capture of what we're doing today, today's conversation. Right. So, Bryn, you guys came up from Bakersfield. You guys are doing exciting things. We work closely together on different projects. But let's start with a healthier Kern and this initiative that you guys have kicked off a few months ago, and it's taking hold, and we've even got to participate.
Yeah, absolutely. Every year we've made it a new tradition within our department to launch year-long campaigns really focused on helping our residents throughout Kern County live a healthier lifestyle. This year's campaign is A Healthier Kern, One Heart at a Time, where we are focusing on a new topic every single month, but then also highlighting people throughout our communities that are sharing what they are striving to be healthier for, in hopes that really incentivize our community members to do the same thing, be incentivized by something to live a healthier lifestyle. It's really going to help us just in everything. It's going to help us do better if we're sick. It's going to help us live a longer life. It's going to give us a better quality of life. And that's what we're striving for at the department. This month's topic is focused on food safety. And so we're also here to really go into depth on food safety and why that's important for our residents.
And there's the tease that we'll tie in with Elizabeth and Chief Standridge. But it's funny where we are in our society that we have to remind people to be healthier. And I fall into that trap where I forget to make sure I go out and exercise on a regular basis, or maybe it's what I eat. And we do need those reminders.
We absolutely do. And if we can be encouraged by others, that's really what we're striving for this year, is to find that encouragement in what other people are using to incentivize them to be healthy. Because sometimes, it reminds us, oh, hey, you know what? I need to be healthier for my dog or for my kids or for my grandkids or for my neighbors or just for myself. I need to be healthier. And sometimes it's just that simple.
Well, life is short, and you can extend your life if you eat healthier and exercise. I know, Key, you started an exercise group at the city, and then it grew to the community, and so on and so forth. The walking group,
right? We started that in the early spring. We decided let's start walking. And we started here at City Hall, and we had people meet. And members of the community came and they joined us. And we had a 1.5 mile loop, and we had a 2.5 mile option. And then the Parks and Recreation District joined in. Our police department was there, and it was just this community gathering. It was kind of like a mobile meeting.
It was.
You were having these different discussions with people that asked questions, and we were taking advantage of the beautiful spring weather.
Right.
And just out enjoying Tehachapi as it was. But we started thinking, okay, we're putting steps in.
Yeah, that's
a little bit healthier.
Good stuff. And then we have farmers market.
Right.
It's only during the summer, but you can certainly go to the grocery store and buy healthier foods. They say don't go to the store when you're hungry, right? Because you'll just load up with snacks and things. But I think that's true. I found that's true actually myself. But people get so busy. I think you need to sometimes just reflect on yourself for a moment, and what are you eating and what are you doing and how you're participating in your own health day to day.
Absolutely. You need to make your own health a priority. And we are trying to give tips and tools and resources on how you can do that, even if you have a really busy lifestyle.
And that busy lifestyle, Chief Standridge, okay, being a police officer, I mean, it's probably, it's one of the harder things to remember is you got to take care of yourself while you're busy on the go.
All the time. It's funny we talk about this topic is recently I had got an email from one of our health providers talking about a stretching program. And I am horrible at making myself stretch every day. Well, it's painful. And, you start thinking you really don't have to do that much to really impact yourself, but you don't set the time aside. So I signed up for this program. It develops the stretching program for me, comes right on my cell phone. And it reminds me if I don't do it every day. So I find myself now being challenged that I don't like getting the notification. So I jump on there and do the stretching. So now I'm like 3 weeks in and, I'm feeling better. My back, my hamstrings, I'm able to get out of the bed in the morning and I feel a lot more loose. And in the evening, I'm more relaxed. So it's amazing of how just little bitty steps can really improve your overall quality of life.
I was thinking about getting one of those desks that raise up so you can stand and work, because I'm on the phone or on the computer so many hours per day and I just feel like it's like,
Yep. I have one and I love it because I don't sit still very well. And it just helps me stand when I want to stand, sit when I want to sit. You kind of don't have all of your weight just sitting on yourself all day long. Because many of us have those jobs where we're sitting behind a desk 8-9 hours a day. And it's nice to be able to have that movement in your day.
Right. And the people that work, let's say in the field, they need to actually take rest breaks too, right?
Yes.
So it's a balance of your physical and mental health, I would suppose.
Absolutely. Yeah. Absolutely. Your physical health and your mental health go hand in hand, and you absolutely need to take care of both of them.
Yeah, I know that my watch goes off. I have an Apple Watch and it ever says, it's time to stand. Please
Mine
stand.
actually, every once in a while, it says your heartbeat is too high. I'm like, what? It's the job, I guess. It's the job. I don't know. But I'm like, I need to reset that thing and, put it at a higher rate. I don't know.
Now I know why you're kicking me out of your office.
I know, right?
You look at your watch, and next thing you know, the meeting's over.
Yeah.
Now I know why. I'll have to watch what I bring in there.
That among other things. Yeah.
But the walking groups that we started in the spring, that kind of led to Tehachapi Valley Recreation and Park District. We'll give them a little shout out because they created a fitness challenge, and they challenged the community to walk, ride bikes, and swim. And then you could create a team. They tracked miles, and they had the spring challenge, and then they had the summer challenge. The summer challenge just ended. Summer ended up with 50% more miles. I think there was 50,000 miles that were put in by the Tehachapi community within 2.5 months. And then the summer, it went up to 70,000 miles.
I think it was like 71 something. I attended their meeting last night. There was a ton of people there. They gave them awards, which I thought was really cool to acknowledge the exercise. But I believe they said almost 72,000 miles in walking, biking, and swimming.
Right.
Yeah.
And so your team could be up to 20 members, and then your combined mileage you would put in. And so they had team awards and individual awards. And Daisy Weave from our finance team was the overall walker of the year. And gosh, she had over 700 miles.
I don't know how you could actually walk that many miles in a couple months, but she did it.
Yeah.
I mean, it was recorded by her phone. So.
Yeah. Yeah. And
unless she put it on her dog's tail, and it went around. But no, Daisy is, she's a go-getter.
Yes, she is. So we're trying to embrace that healthier lifestyle and fit into this Healthier Kern initiative that you guys have put forward. So, and like I said, got to give TVRPD credit for coming up with that part of the program, but we're trying.
So if people want to learn more about your program, your website, how would they know? You can say, eat an apple or take a walk around the block, but are there on your website, are there pointers, that they could go to and learn a little more?
Yes, absolutely. So on kernpublichealth.com, one of our main buttons on the home page is a button to go to a Healthier Kern, where we have all kinds of information about how people can live their lives healthier. We have encouraging messages from people throughout our community, and we just have all of those more in-depth focuses for each of the months on there as well, so people can learn more about those topics and just learn how to weave them into their regular everyday lifestyle.
Maybe, jumping on what you were talking about with the city and TVRPD, maybe the county of Kern could create some friendly competition with communities. Right? Eating and exercising, right? I'll throw that out. We'll see what happens with that.
I do love that.
Yeah.
We're in.
We're in. Okay. We're up for the challenge.
And then Michelle will help you promote it.
Yeah.
Okay. We'll
Michelle's sitting in the corner over here like, oh, this sounds like work. but good work.
We're in. We're partnership, the collaboration, and maybe there's a PD versus there's a Guns and Hoses challenge here somewhere down, where, you guys take the lead and say, hey, KCSO, KCFD, what are you doing?
Mm-hmm.
I can see that. Definitely.
We have a city manager group. We meet every Tuesday. Maybe I could challenge those guys to do something and put my phone on my dog's tail.
Yeah. So you've got some ideas
seriously
flowing.
though, right? I mean, we could challenge each other. There are 11 cities in Kern, so there you go.
There's some ideas. We're ready.
Yeah.
We're in.
I know the sheriff likes to hike Panorama. So I'm not above.
Are you calling him out right now?
I'm calling him out.
There you go, young blood.
I'm not above, police chief challenge. See which chief puts down the most mileage.
There you go. I have a feeling he's a biker. So Chief Standridge is a biker. So you might
your team,
lead the pack.
Your team, you had a marathon team that was a part of the Bakersfield Marathon.
We did.
And you had participants in all different facets, and they were unified. They got special jerseys between the marathoners, the half marathon, the 10K, and the 5K.
We did.
We had across the board representation, but it was thanks to your team.
Mm-hmm. Yeah, they did. They took the lead on it and organized it. Yeah.
Yeah, we were talking earlier about potentially bringing the Grand Fondo back to Tehachapi, and maybe Kern Public Health could participate in that healthy aspect of being outside and biking and that stuff. So there's a challenge for you.
I'm all for it.
There you go. All right.
Okay, so we got this. So we got it. It's recorded. So Bryn and Kern County Public Health is in as a collaborator, and maybe they'll put it together for us.
Oh, do all the footwork?
Yep. Okay, maybe a little too much.
That's a whole different level.
Oh, so next Kern Chiefs meeting, I'm going to throw it out there.
Okay.
I'll tell them Kern County's organizing it up.
I love it. There we go. See what you've got going? Okay. So the energy you brought, Bryn, is going to create some more healthy challenges.
Perfect. I love it.
And then before we transition to another topic, Greg, you got to participate. Emily came up from your team. We shot some footage and a part of your marketing campaigns. Let's talk about the marketing campaign, because we talk about Healthier Kern, but there's some things that are out there that you guys are putting on social media and the media, billboards. Let's talk about that.
Sure, absolutely. So every month we focus on different folks throughout different areas of our community and post their reasons for why they want to be healthier. And we featured Greg this month, and it was wonderful. But he's on billboards, he's on social media.
Billboards.
Yes.
Yeah.
It doesn't say wanted, dead, or alive.
It does not. It does not. And he was at the farmer's market for the videos and the stills that were shot, and he is living his best healthy life in these videos, and they're all to help encourage others to be healthier.
Right. So I did shoot a little video. Maya helped with that, and I said, I'm eating healthy for my grandkids. So then when my wife and 3 children saw that, they said, well, what about us? And I said, well, I just went right over you. It's all about the grandkids.
Right.
And you'll only know what I'm talking about if you have grandkids.
It's true.
Right.
Yeah.
And it's so special.
Yeah. Now, eating healthier, that's something that, is a part of this and this initiative. But it really kind of trickles down, and we talk about pace of life in your job that you have, Rich, with the police department and other industries. But we get choices, and there's an opportunity for us to really kind of wake up, pay attention to the choices we make. And this is how your team, Environmental Health, our police department have come together, because there are some concerns that we come across and we should be aware of.
Absolutely. And part of healthy eating is also safe eating. And that's really the focus of this month in A Healthier Kern, One Heart at a Time, is focusing on that food safety aspect. And so always looking for that health permit when you are looking to eat out at a, brick and mortar restaurant, at a mobile health or mobile food facility. I'm really wanting to make sure they have that permit, because that means that they've met certain standards to ensure that the food that you're going to consume is safe for you to eat. And bottom line, that is really important for us at Public Health and our environmental health program.
Yeah, Elizabeth, what are some of the things that you come across? I know we will let you know that if we have a concern. But, in your department, what are some of the things that you come across that people should be aware of?
So I think that when we're out in the field and we're engaging with the unpermitted community, the biggest thing that I want customers to look for is the permit, obviously, but asking questions about where are you washing your hands? How are you preparing your food? Those are the biggest steps to food safety and food preparation and preparing food in a safe manner.
So if you're talking about a food truck or maybe a pop-up tent that you see sometimes, and so when everybody loves a taco from a taco truck, right? Or a breakfast burrito. But there's certain things they need a health permit that's clearly posted, I suppose, right? And they need a home kitchen, those sorts of things, and facilities. If they need to use the restroom, where do they go, right?
Absolutely.
And how does that all? There's a much bigger global picture to a pop-up tent or a taco truck, if you will.
Absolutely, absolutely. And there's a process in the permitting process. We look at how an operator is preparing food, where an operator is preparing food, what types of food they're preparing, how long they're going to be at a location, and all that information helps us identify what type of permit they're going to be qualified for.
Right.
But just as a member of the community, if you're out and about and you're saying you see a place you want to stop and eat, they should have a permit. That's the first step. If you don't see a permit, you can ask to see a permit. But the kind of things that we're looking for when we're doing enforcement is, are they safely storing their food? Are they safely preparing their food? Have they have a place to wash their hands? Those kind of elements.
It's just like when you walk into a restaurant. When you walk in the front door, you see the A or the B or the C, if you will. And so there are a lot of very legitimate taco trucks, I'm going to say, quote unquote, and any of these pop-up events. But you just want to make sure, because if you've ever got food sickness, what is it called?
Foodborne illness.
There you go. Thank you. That's the technical term. Then you're going to remember that for a long time. Probably never forget it. So we just want to make sure that you eat healthy so that you can have a good time that evening.
Yeah.
If that's the event.
And we call them mobile food facilities. And that may be a full mobile truck, and it could be a cart. And there's lots of different variety and options for vendors and options for people when they want to go out to eat. Yep. So the first thing, the most obvious thing to look for is the permit, and it'll be a sticker, or maybe depending on where you are and what kind of operation it is, it may be the actual printed permit. But that should be available for anyone to see, even if it's a brick and mortar facility.
Yep, that's right.
Everyone will have one.
That's right. Yeah.
And that paper is, it's easy to say, oh, you need a permit to do that. And it may not even just apply to food, right? There's lots of permits people have to get to operate a business. Don't think of it just as a piece of paper. It's an agreement between the vendor and the health department that the vendor is going to do everything they can to meet the minimum requirements to prepare and store food safely for their customers. It's an agreement at the bare minimum.
Yeah, it's not just bureaucracy.
Correct.
It's a way to keep the public healthy.
Right. Yeah. And I think that's an important takeaway for everybody. We're not just saying you have to have this permit because we want you to put it on your wall. The permit says to the public and says to the health department that you're doing what you're supposed to do. You're meeting the food safety requirements. You have hot water. You have sanitation. You have hot water. You have ways to sanitize your dishes. You have soap in your sinks. You have paper towels. All the things that we may take for granted when we're going out to eat at a restaurant or a mobile food truck or any type of food operation.
Kind of like what you have at home.
Well, I think, even like if I'm grilling at home, I'm running back in to turn on the hot water. I'm washing my hands. I've got the sauce, whatever it is, I need to have direct access. So that way, whatever I'm prepping outside mobily for me is best for my family. And it's like, those are the things I think we think about that 5 minutes. Oh, hey, there's the Easy Up over there on that vacant lot. Let me go pull over and let's grab hot dogs. Well, that doesn't mean that they're being prepared correctly or to the standard that keeps us healthy.
Right. And I think it's also, you mentioned cooking food at home, right? Yeah. So we want to make sure that people are preparing food in an approved commissary and not preparing food at home. There is a permit for some home food preparation and sales, but it's very limited, and we're not talking steak dinners and lobsters. We're talking a very small window of things that you can prepare at a home kitchen, but it's still inspected by us on a regular basis. You still have to meet certain structural requirements and sanitation requirements. But when you're cooking at home, do you have pets at home? Do you have other people who come in and out of the kitchen? Are you wearing the proper, clothes when you're preparing food? So we want to make sure that food that is being prepared under a permit is also being prepared under the appropriate situations. Does that make sense?
Oh yeah, absolutely.
Okay.
Yeah. And I was Rich, Chief Standridge, when you think about it, like I just even mentioned, hey, see the easy up on that corner, and I just pull over real quick. I mean, there's other safety hazards that come to mind.
There's quite a few of them. We don't know who these folks are who are serving, and that's why City of Tehachapi, we require them to have a business license, so we have a point of contact as to who's responsible. There was one a couple of months ago. We got a call, a report of a food vendor, and we go out there and check, and they have raw meat out, exposed, barely covered with tinfoil. They have it on a tailgate. They have an open cooktop. And when you pull in to get your tacos, the dust flies up. It's all over the food. And, we have to shut them down. And, there has been, discussions that some of these people, are basically put into a servitude of that they're out there doing this almost like a human trafficking type operation. When we have shut a few of those down, they basically tell us we cannot shut down till we get a hold of somebody who gives us the authorization to shut down. And so, they'll make phone calls and we stand by with them sometimes up to an hour until they can get the approval to, even though they've shut down, they're no longer serving because we're there, but they have to get the approval to, pack up and leave. And so there's some issues there, that we have to do follow up and things on. And that's what we want the public to understand. I spoke to a group recently here locally, and they were just under the assumption based on social media that Tehachapi Police Department and Kern County Health don't want any food trucks in the area, and we just go shut everybody down. That's quite the contrary. We just want people to follow the proper rules and regulations so we have points of contact and people are safe. We don't want a citizen to go out and get food that is spoiled and, that can ultimately result in severe illness and even death in certain instances. And that's why we do what we do. And the funny thing was, when I explained that to this group I was speaking, they had no idea that those are the things we're looking for. They just thought we were shutting them down because local brick and mortar businesses complain. And I told them, no. It's much larger than that. It is an issue for brick and mortar businesses to compete with these food trucks and things. But ultimately, what we're looking at specifically is the safety aspect and the health aspect.
And then there's also the location that they pick.
Correct.
That becomes another hazard.
Correct. They start backing up traffic. They're in parking lots that aren't safe. They're not lit. They're in intersections that are high risk for speed, stop sign violations, and different things. So you'll get people making illegal U-turns when they leave these food vendors and things like that. We have near misses or collisions. So it just becomes an overall hazard to everybody's health, both safely on the road and, the physical health as well. It can become a huge issue that we have to look at as public safety. And ultimately, our goal is to keep the entire public safe. And sometimes that upsets people when we have to shut down their favorite local taco vendor, but that's what we have to do.
Yeah, this conversation is not about, picking on an individual group. This conversation is clearly about public safety, whether it's foodborne illnesses or, the safety of pedestrians and vehicles moving about. I remember, Bran, several months ago, there was one of the carts that sell fruit and, pineapple and whatever. And I saw the guy, I'm not going to say where, it was in the Tehachapi area, but he left his cart. I was driving by and he was urinating in the bushes and he had no facilities. And I thought, well, that's not cool, right? Well, he's going to go back to that cart and start cutting pineapple and watermelon and this and that without proper facilities. It grossed me out. But also, I called you and you immediately dispatched someone for good reason. And that's to protect public health.
Absolutely.
Right. I mean, it's a very specific example, but there are reasons why we do what we do, all in the interest of, providing the best service that we can to our community.
Absolutely.
Yeah.
So with that Elizabeth, I bet you've got some stories, and I gotta pull. I need one. I need one right now. I need you to think back. Give us something. It doesn't, and we won't give a location. Okay, but somewhere here in Kern County, you experienced what that will never leave your memory?
I think the story that I think of the most, the image that is probably burned in my mind the most was maybe like an entire cow skull that was sitting in the bed of a trailer that had been boiled and then cleaned and then used to make food. And it wasn't the cow head and the meat that stands in my mind at all. It was the fact that it was sitting on the side of the road and had been prepared on the side of the road and under some pretty unsanitary conditions. Mm-hmm. So when you are preparing food as a permitted operator, you have to have some basic knowledge on food safety and preparing food and in the manner that it should be prepared and stored. It's not just let's cut up something and then put it on a plate. There's lots of things that are involved in that. And people who are permitted and people who are running these businesses know what that entails, know what goes into all of that. And so sometimes it's providing education as well. When we see things like that, hey, did you know that there's a proper way to store your meat? They do know that you should be sanitizing in between cutting fruit and cutting, let's say, more meat. So getting that information out too is a big part of what we do, providing that education to people, because sometimes people don't mean to prepare things in the wrong way or store things out of temp, or they don't realize that you need to store things at 41 degrees instead of 45. So we make sure that we get that information out to people as much as possible, even if they're unpermitted. Even if they're unpermitted, we hope that they become permitted someday and they'll use that information the next time they come out with their permit.
Right. I don't think anything's intentional on any side, whether or not you're aware of what you're eating or what you're serving. I think people just education is probably the key.
Yeah.
Right? Be aware of what's going on around you.
Absolutely. Sometimes we also see like large drums of water and people will use that to wash their hands and cook with, but you can't store water in that manner. So you need to have an actual water source, whether you bring it out yourself or you're attached to something else that has that water available. We want to make sure that you're not using something that shouldn't be holding water in the first place, especially if it's going to be used for cooking or drinking. That's another thing that I see sometimes a lot.
Well, you bring up water. With the city of Tehachapi Key, we have a fresh water supply, right? We have a corporation that provides fresh water, and we test that water all the time. And sometimes once a month, I believe, we go to certain houses and we'll ask, can we test your water from your tap? So we're just testing all the time to make sure that the fresh water source is appropriate.
Right. And I think that's something that people often forget too, when you're talking about one of the things we do with permitted facilities, whether it's a grocery store or a restaurant or even a mobile, is deal with recalls, right? So we've all heard about them. We've heard about watermelon being recalled or some kind of sausage or some kind of product being recalled and not to eat it, to throw it out. Mm-hmm. And we call permitted facilities and make sure that they're aware and removing this stuff from their shelves so they're not inadvertently selling it to the community. Mm-hmm. If you're not permitted with us, we don't know what you're selling. We don't have a way to contact you. We can't let you know that, hey, if you're selling cantaloupe, maybe you should be removing it. Or if it's from this vendor, or if it's this specific product, there's been a recall, so remove it from your shelves.
I think in the United States, we take a lot of it for granted because you guys do such a good job at that. In other countries, it runs rampant. Listeria, is that the right word? Listeria, yeah. Salmonella, all the Boar's Head recently, that's been in the news, right? A giant corporation. I love their deli meats, but they had a problem. And you guys were able to, or your colleagues were able to go back to the source and find what's up and kind of nip it so that we can stop that disease, I guess, from spreading.
Yes. And that's really the importance of the foodborne illness piece of all of this too, is if somebody gets sick and they're able to say, I went to a certain place and ate, we go back to that place and look for the source. And then they may not even be, ground zero. They may have a product that they've purchased from somebody else that is the source. And sometimes you just going to the doctor and getting diagnosed with a foodborne illness and that getting reported back to us allows that investigation to take place, and that will stop other people from getting sick because that product can then be recalled and not continue to make others sick.
Maybe save a life.
Exactly.
Because if you're a pregnant woman, those things matter a lot.
Definitely.
Yeah, and I think sometimes I hear from people that, I've never gotten sick from eating at a vendor, or I've never had foodborne illness. And there are sensitive groups in our population that are just going to be impacted a little bit harder, elderly, children, and may not, especially children, they may not be able to control where their family takes them to dinner. So it's not just about healthy and unhealthy individuals. It's about making sure everybody has access to food that has been prepared in a safe manner to reduce the potential of foodborne illness.
It's really a global effort.
Yes.
Because the food comes from all over the world these days. Didn't used to, but it does now.
Absolutely.
Yeah, food is regulated at a lot of different levels, federally, at the state level, and locally with Kern County Environmental Health and Public Health.
Well, the City of Tehachapi is definitely your partner, so we appreciate what you do.
Thank you.
Yeah, well, you are our health department.
Yes.
That's true.
That's one of the departments that we don't have here at City Hall, that we rely on your office to take care of all of these things for us. And it's such a great way when we see these collaborations and that Chief Standridge and his team can reach out and there's immediate connection. And you guys, we talk about collaborations a lot here in this room, but this is one, it's all, as you said, Greg, it's about public safety, and everything always focuses everything that we do on public safety. And sometimes it takes partnerships.
It does, and we have developed a great relationship with Kern County Public Health, and one of the things I want to stress to our public as they listen to this is we are not necessarily immediately wanting, punitive enforcement. We want education, compliance, and collaboration with our local vendors. We just want them to ensure that they're following the rules to be as safe as possible for our public. And we do that through our relationships with our, colleagues at the county. And I think that we've made great strides here in our area. And I just look forward to us continuing to do that to keep our public safe.
Well, and our servers in Tehachapi, our restaurants, they're amazing. They do a great job. They all have A's, and they serve, and they good food, good corporations. They employ good people. So we want to thank all of our restaurants.
Absolutely. Well, Bryn, Elizabeth, anything else that we haven't touched on that you'd like to mention?
No, just want to encourage people to follow us because while we're talking about food safety right now, we cover topics every month and they're relevant to everybody in our community. And we're just here to help everybody live a healthier life so they can live a longer life, a more fulfilling life, and have a better quality of life.
Right. And you utilize your social medias to put out a lot of messaging, just like we do. What are the social media platforms that you utilize, and how can we send it? So let's invite
come on
Michelle
up.
to come on
up. You can use my mic.
Yeah.
Oh my, I'm fancy.
Michelle, welcome back to Tehachapi.
Hi, I love Tehachapi. Okay, we are on Facebook, Instagram, X, LinkedIn, and YouTube, of course.
And is it all at Kern County Public Health?
Yes.
Okay, perfect.
And our website is kernpublichealth.com.
Okay. There we go. We knew we'd get her in.
I made it to the dinner table, the big kids table.
She was sitting at the card table before. Now she's at the main table.
That's right. So we invite everyone to follow along, and then the messaging, and then as we see it and Michelle tags us, we share your message and get it back out to the community. So it's growing those partnerships, collaborations, and working together, and knowing that everything that is done here is done for the public's best interest so they can live a healthier life.
Yes, absolutely.
Good. Chief Standridge, anything in closing?
No, I'm good. Thank you.
Okay. Elizabeth?
If I may add one thing.
Please.
If you want to become a permitted vendor,
Okay.
Give us a call. Set up an appointment. We'll walk you through the process of of obtaining a permit.
Perfect.
I always say to people, if whatever you want to do, we have a permit for that. So give us a call, come in. We'll help you through that process and what it looks like on our end and what kind of operation you need to be running, what equipment you need. And then we'll get you through the plan check process once you get our application completed with us.
What's the phone number?
661-321-3000.
321-3000. Okay, great. Perfect. Bryn?
I'm just happy to be here, grateful for all of the partnership that, City of Tehachapi brings to us. I'm happy to work together, grateful to Greg for participating in our Healthier Kern campaign, and look forward to just helping and encouraging our community to be healthier.
Yeah, thank you. Greg?
Awesome. No, I'm good. Thank you very much, Key.
Yeah. Well, we appreciate the time that you've invested to come in and just to talk to our community directly. So we appreciate the time invested by Kern Public Health to make this a healthier community. And folks, we appreciate the time you spend with us. And if you've got any thoughts or questions based on today's discussion, send it to us at media@tehachapicityhall.com. We'll forward it on to Elizabeth. Maybe it's Chief Standridge, to Bryn Kerrigan, maybe Michelle Corson over in the corner. Greg or I, we're here to make sure that we can answer those questions for you. So take the time, media@tehachapicityhall.com. Again, thank you all for taking the time. We appreciate it.
Thank you.
All right, we'll catch you again soon right here on Tehachapi.